Hey folks, Alex McMahon here of Evolve Nutritional Therapy. Today we're continuing on in our video series on nutrition myths. And myth number 10 today is that salt is bad for you and will cause you to have high blood pressure. Now, for the group of people who have what's known as salt-sensitive hypertension, an excess consumption of salt will cause their blood pressure levels to rise to an unsafe level. So for those people, they do need to be hyper aware of the amount of salt that they're having in their diet. For most people, though, this isn't a large concern and it's not going to cause excessive raises in blood pressure. However, there are other big lifestyle factors that most people are dealing with on a day-to-day basis in our American society that do put people at an increased risk of having high blood pressure. One of the biggest ones is being overweight or obese. Now, part of the reason for that is when somebody is overweight or obese, they're placing an extra burden on their vascular system and making it work much harder to pump blood around to all the tissues and then to pump that blood back to the heart. That extra work is going to manifest in having a higher rate of blood pressure. Now, before you want to go and throw out all your salt, keep in mind that sodium is actually an essential mineral, and it's something that we require to maintain the right amount of fluids on the inside and outside of our cells, which is extremely important to our health. Another thing on the flip side, before you go eating spoonfuls of salt, is that most Americans are actually consuming 2 times the upper limit of salt that they should be having on a day-to-day basis. Now, anything in excess is going to be bad for us. Too much water, too much air, too much sugar, too many carbs, too many calories, too many fats, all those different kinds of things can all be bad for us. So we need to take a real logical look at things and have a more balanced approach to our nutrition. Things aren't necessarily always as black and white as they're made out to be. The big thing to keep in mind here is that most people are actually getting their salt from processed foods, not salt directly. So in looking at the salt, we can see that salt probably isn't going to be a huge concern for most people in terms of degradations to their health and causing high blood pressure, but we need to have a balance in our diet. You shouldn't be getting way too much salt, just like you shouldn't be getting way not enough salt. So keep in mind, it's all about balance. Salt is not inherently bad for you, and it's not going to cause you to have elevated blood pressure. Thanks for watching, and I'll see you in video 11.